Good morning, everyone, and welcome. Happy Monday. Hi, Steph. Hi, Hi, Beth. How are you all today? As we welcome people in on Substack, YouTube, and Twitch. Good morning, everyone. How are you?
Good morning.
Morning.
I wanted to make sure everyone sees too, as you'll notice there's a little bit of a background change for us. Um, Thanks to the amazing support of Stephanie Wilson, where we've gone through some good updates this morning for our title screen and our background. So it's the Sick of This Show Monday mornings, chronic illness in practice. And I'm excited to update our background scenery and have some fun and talk to my good friends again today as we discuss a topic that I think this was your idea for this week's topic, was taking care of others while we're ill ourselves. And how do we manage that? How do we sometimes not manage that? What does that look like? And how do we maybe learn some lessons from each other? So anyone too in the chat, feel free to chime in with if you have chronic illness and you are also sometimes taking care of others. It's always lovely to hear everybody else's stories too. And so good morning. How is everyone? And with that framing, how are you guys doing with life and possibly taking care of others while you're ill yourselves? So I'll hand that one over to you today, actually, first, because it was your show idea, rather than leaving it open-ended. So good morning, and I'll start saying hi in the chat and all the good things.
Okay, well, hi everyone. I'm really glad to be here with you guys today, which is the reason why I wrote so I'm okay today, because you might not know, but the reason I'm also here with my dear lovely people here, Nick, Stephanie, and Beth, is because I have fibromyalgia, and sometimes I have really bad flares. And I had a bad weekend. I think I slept like 36 hours. So I'm just really happy to be able to be here this morning and to actually discuss this topic, which was really on point, because I had a call from my mom yesterday, who is 73. So she is also, she's always been in very good health, but she had a pretty big scare in January. She had a 4 bypass surgery, so I ended up having to care for her. And now she's more fragile, which is normal after such a big surgery. And she has been getting better, but since a week, she was having a shingle flare. And yesterday, she got a phone call she also takes care of she's there for her older friends. And unfortunately, one of her very good friends that's older is in intensive care. So it feels like it's kind of like a domino effect, It's like she's taking care of her because the doctors called her. And then that's a long story, but my mom is the name that she gave. She has children, but she is not in touch with her kids. So my mom is the referral at the hospital. So they called her, and my mom was like, "Oh my gosh, I have a shingles. I can't go." So it's kind of like, so when she gets better, she's gonna go see her. But I mean, right now she's in intensive care and asleep, so it's not like she's gonna know. But she has to, inquire about her. So it feels like a domino effect, because now I'm calling my mom and asking, "So how is she? How are you?" So it's kind of like it was right into the subject. So yeah, I feel like a lot of us, I mean, it feels like it's part of life too. It's obvious. I mean, it's just that it's kind of such a struggle when you have your own challenges in terms of health. So this is how I can introduce the topic. I was musing on that. I mean, it was the week even before the starting point was when she called me, and we had to bring her to the hospital because she has her first shingle, and it was like, going into her eye. So we had to bring her to the ER. So that was a week ago, and now this week, her good friend is also at the intensive care. So it's kind of like, phew. So what about you guys? Do you, I'm just gonna say hello again to everyone in the chat. Have you been in a situation, or are you in a situation that you also have to take care of others while you are struggling with your own health issues?
I have had to. I have to fly back and forth to Michigan. My dad is almost 91, or will be this coming year. And he's had some health issues. He had a GI bleed this last year.
Oh, my mom had 2 of those.
Oh,
Bad.
it was awful. It was just awful. I had flown in. I was going there for his birthday, and I was probably at his house for 3 hours before I said, okay, we're going to the ER, and he was admitted. And so, yeah. And when I fly, it's like when I get these messages, hey, your dad's not doing well, it's book a flight, no matter, what condition I'm in. And so that's really difficult. And then going and driving back and forth to where he's at and going to the hospital, my first thing was, oh my gosh, where can I park and how far do I have to walk? Because psoriatic arthritis, I have bone on bone in my right knee. And I'm like, oh gosh. So I had to push through in a way this last time like I never had. So yes, caring for somebody when you are struggling yourself, and yet I didn't want my dad to know. I was struggling because I didn't want him to worry. And so it's a lot of kind of turning your head and going, oh my God, it's just,
That's such a big deal. I hear you so much. Like, what is it with us? Like, we don't want them to worry. So we're really just hiding our own physical state. It's like, I'm in pain. And it's like, I don't say anything,
I don't think fibro is one that my father would understand. He's very, he has his wits about him. You can talk to him, have a conversation, but I don't think he completely grasped that you can't see my pain, but I have pain. So that's kind of I didn't even really want to lay it all on him that I was struggling to get air, struggling to walk. And another thing is I didn't hardly eat. I actually lost like 20 pounds when I was there because I'm driving so much and I have stomach issues with my fibro. In fact, I got sick this weekend and I projectile vomited. It just comes on as a nausea and I feel sick, and then I'm fine. So yeah, it is hard to care for somebody when you're struggling to care for yourself. That's been my experience.
Same.
Anyone else?
Oh yeah. I'm like right smack in the sandwich generation. So I've got an almost 18-year-old who's got really high anxiety and ADHD and freaks out at the merest suggestion of anything. And then also he has migraines, and my parents, so I don't live near, like as you do. My mother is in DC, my father's in California, my in-laws are in Maine. So like mostly I get out of the having to care for them too much because like my brother's near my mother and my step siblings are near my father, and my in-laws are only 2 hours away, but we're going to move there next year. So but my mom also had 2 GI bleeds, and she fell and broke her face basically. And like her occipital bone she broke within the last year. So yeah, it's been a lot, and mostly my brother does so much of it. But but you know, one week he was like out of town, and so I had to fly down there and like take care of my mom, you know, after she had gotten out of the hospital. And this is the weirdest thing. So she's not a nurturing person, to say the very least. So she seems to have had a stroke at some point, and it made her not quite as mean. So I was able to stay there for 5 days without like wanting to slip my wrists. So that was something. But yeah, and my dad got hit by a bus a couple of years ago. So I went out there. Yeah, it's really, really hard. And like, they don't want to, Dad's fine, by the way, except for the dementia. And yeah, it's hard when you've got them and you've got the kid and everyone needs something. And often I can like push through on meds and adrenaline. And then as it calms down, then I like completely lose my negative positivity. You know, I lose it and need to be sleeping and stuff. So
I was
yeah.
I was about to say that feels like a pattern. I don't know about what everybody thinks, but it's like you're not feeling good. Like, for example, like I have pain, so I'm like on Tylenol, I or whatever helps. And then it's like I push, and then when it stops, like it feels like it's less urgent, then I crash.
Yeah.
That's kind of like
Yes.
It's like in college. I don't know if you guys like were either had something big at work or like in college when you had like all these finals and you like managed to get through them and then like get sick the minute they're done, you know?
absolutely.
I have done that forever. Yes. In fact, it's always like if I went through in the past like a really stressful job interview or something, and I've landed the job and, you know, been through 3 interviews, I will start my job and get violently ill and have to miss work. It's whenever my body just seems to relax. I also have IgA deficiency, so there's a little piece of my immune system that's not quite functioning right. So I'm down for the count. Yeah.
Oh, what does that involve? Sorry, I'm not sure I know the
It's a IgA deficiency. It's something like in my upper respiratory part of my immune system. So I get frequent sinus infections, a lot of sinus infections, lots of steroids, lots of congestion overall. And so what I have found so far, there is a nasal spray my doctor ordered, and that has helped me stop so many sinus infections. So it's like, okay, that's a win. I'll take a win.
Yeah.
Yeah, I've realized that a lot of things are like all a result of just the stress and the compiling efforts. Sorry, I'm a little. It was a foggy night last night for me. So I'm a fibro sufferer. For anyone who's new in our community here, I have fibromyalgia plus some spondyloarthritis in my spine, neuropathy in my legs and feet, other sorts of chronic conditions, migraines, things like that. It all kind of sucks. And yesterday I had a side effect from hypothermia that I once got, where my body will get really like, I'll lose control of like temperature regulation, and it'll get really, really cold all of a sudden. And then it takes a while to snap out of it. So that happened last night, and everything went just like down from there.
It's not fun.
But I have two kids, so I deal with, or I don't get out of not caring for somebody, even when I'm sick, even when I'm not doing much as a parent, because say I'm sick myself at a time, is I still have two kids that I have to make sure that I take care of and are a presence in for their life. So I would consider that part, all, at least for all of us who have kids, which is all of us, is we always have to take care of someone. Even if they're adults, you still, like my parents still take care of me at times, and they don't stop being parents just because you're over the age of 18.
Good point.
And so I'm also in the possible process of needing to take care of someone for short term, or help support take care of someone for the short term. And I won't give any other information about that someone, just for their privacy. And I know that is going to be its own interesting situation, because a chronic illness sufferer possibly supporting a chronic illness sufferer who is recovering from surgery, it will be interesting. But that's what family does, and that's how family takes care of each other when we can. And I'm in a position where I could move my computer wherever I need to and still podcast and still do my shows and be able to support if I need to in a different way. So I think on a positive side is, because I lost my job in tech, I am not slammed, as old saying, balls to the walls, all the time. Is I'm not just going 1,000 miles an hour every minute to get everything done. Like it was asked, do we know the idea of getting sick after working too hard? Every single time I make myself sick somehow after working too long or too many hours.
You don't make yourself sick, but your immune system like holds it off for just long enough, and then it takes a rest.
Or it's the immune system. To me, sometimes it almost feels like the immune system, or the body is finally just like, I am done pumping out all these endorphins and this dopamine, and so my response is to feel sick, even if you aren't really sick, because the sudden withdrawal of all that dopamine and endorphins, it's almost like a crash from a really bad high or something like that, and those can make you physically ill for a period.
So my question to you, Nick, is what is the difference? Is there a difference between feeling sick but not really being sick, and actually being sick if you feel like crap either way?
No, maybe. I think feeling sick doesn't necessarily mean you have a virus or a bacterial infection, whereas being sick is. But then again, mental illness, you are, well, it depends. Certain mental illnesses I would consider as more on the sickness side, but I don't know. I don't know. That's a really tough question, Stephanie. For such an easy question.
No, but I would suggest that when you feel sick, you are sick. And sometimes there's stuff you can do about, like, it's a bacterial infection, you get some antibiotics and hopefully that'll help. But a lot of the time, even if it's a virus, you can't do anything. So I would suggest that feeling sick and being sick are essentially the same thing, except maybe you beat up on yourself more if you don't have a diagnosis.
That's fair.
Somebody in the chat mentioned hard to pace yourself. P. Shelton, hard to pace yourself when you can't predict how much is too much. And I like, I want to bring up the wording pace yourself, because I have to say this is something that I discovered. Well, I knew what it was, but like really learning how to do it for myself was actually when my mom was had this surgery in January, and she had 4 bypass. So it was like she spent 3 weeks in the hospital to wait to have her place. So Christmas we were going back and forth at the hospital before she was waiting for surgery, and then she had the surgery on January 7th, and then I mean, what, 5 days later I brought her home. I'm so happy that I did, though, convince her to come at my place, because it was so much easier for me to take care of her. I had an extra room, like than just going and moving to her place. But so it was really like this focus on, okay, I have to take care of her. She's not even able to, I mean, you can imagine it's open heart surgery. So she wasn't even able to like pull herself up. And, so it was really like focus on her needs. Then what's like the most important thing that I have to do for myself right now? Well, eat, like that's about it. It's like, so, and then just whatever doesn't feel like it's an emergency, then just let it go, So pacing really also involved, well, with fibro, of course, a lot of physical, breaks, pacing. Like I would actually, when she would sleep, I would like, just go down and lie down in the next room on the couch and just sleep too, and then it was really just focusing on it. It's almost like you're bringing yourself to the same rhythm to the person. But yeah, anyway, so I find that pacing yourself is, it's hard to understand what it means. So I had to read about it and then I was like, okay, I need to apply it to the basic core of it,
Well, we have in the chat too, is E. Shelton is saying counterintuitive, resting before you can't do otherwise. And I wish it was that easy. Like, I wish it was so easy to just be like, yep, I need to stop and rest right now before I've gone too far. Because the thought process, at least for me, that goes on is if I rest now, I won't get back to it. It'll be, that's the end of this until I can get back to something. And so I need to finish it before I can actually rest. And if I don't finish it, I'm not able to rest. And I think part of that is a conditioning from just work culture. Like you have to complete tasks, or modern work culture anyways, at least for tech too, is that idea you have to get a task done before you're able to stop. And if you don't get it done, you're kind of a failure. So go get it done. And I think that permeates a lot of our society just as a normal cultural trend. But yeah, I think learning to be able to actually stop, as easy as it sounds, is really hard.
Well, Nick, I think you have a very good point that it also has to do with the work culture and productivity, because I don't want to just blame it all on capitalism, but it's like you need to have a product and it has to go out, and if it doesn't, then you lose money. But if you look at the way that, like, for example, if you work in like social services, for example, you're much more likely to be understood in a way, like, but then still, if you want to be, if you want to have some time off, then most of it would be built around, you have to have a, medical diagnosis, you have to have like a doctor's notice, like, do you know what I mean? You still have to have a reason for not being able to just physically be there at work when it's like more than 3 days. So well, I guess the reason I'm pointing that out is because, especially in my past work experience, well, if people don't know, right now I'm at home. I haven't been in the work field for about almost 6 years. And I don't miss that, having to justify the reason that I'm not at work. That I mean, but I can understand because the income has to come from somewhere, and I'm not excusing it. It's just the way it's done. The insurance will want to have some sort of I don't know. Do you know what I mean? Like I find it's very complex.
Mm-hmm.
It is. I haven't worked in the workplace for 14 years. I've started 1, 2, 3 businesses and 2 nonprofits. And since then, but it was kind of all on my schedule. So that really helps. Like, I think one Friday when I was going to be going on the book club, like everything hurt. And I was just like, sorry, like, can't do it. In fact, from this show, which had a clip on LinkedIn, a friend of mine from when I was 17 saw it. She's not really on Substack, and we've been out of touch for at least 20 years. Saw it, contacted me because she's had vestibular migraine for 27 years. She didn't have any idea what I was going through, but the fact that we're here is, I hope, I mean, that was one amazing thing that came from it. And yet the first time we were going to talk, I was completely flat out and had to reschedule. So like real life and fun life sometimes don't work together, And one of my businesses, like, sometimes it's like in-person workshops for 2 days, and I can't do that. I cannot. And so I have to let everybody else do their thing and then maybe come in for a little while. And it's really hard on the ego, but it's,
I get that.
It is hard.
It is. Yeah, it was wonderful to connect. So I think forgiving yourself is a really big piece of it here. Because we can make ourselves crazy by saying, oh, I should have done that. I wish I had done that. I can't pull out of that. I have to do it this way. I have to do it that way. And I think for me, like, learning to be more gentle with myself and try not to say things to myself that I wouldn't say to a friend. Has helped in like radical acceptance. But there's also 25 years of therapy in there. So that has definitely been helpful.
Sorry.
Oh no, go ahead, Soso.
Well, I just wanted to say something that quickly that just popped into my head the moment you said it, is how easy it is to blame ourselves, where the thing that I find we have to work on, that's the hardest, is not to, hit ourselves on the head, but tap ourselves on the back. Like, that's what you would do to a friend, right? Like, you're there to uplift them. But why is it that when it's ourselves, our tendency is, I think like all of us here can relate, we're always like, oh, you haven't done this. Or is it our parents? Is it the way we grew up? Probably, but I don't want to blame them. It's obviously something that we learned somewhere. I don't know if it's, totally biological. Is that it? Like, are we as animals, like saying like, you're not good, you're not this, you're not that, somebody must have said that to ourselves somewhere. I know mine did, but anyways, I think we can unlearn that, but it takes a lot of time. So go ahead, Beth. Sorry, I didn't mean to cut you off.
I'm like, oh, am I going to remember? No, I was going to say, that's the process I'm in right now, is because I've only been out of work 10 months. So I'm new to the process of trying to forgive and accept that this is where I'm at. And it's not always easy because I want to go, I want to do, and it's really hit me hard this year. And again, it's when you step back and the stress starts going.
Mm.
When I left my job and the stress left, my body reacted, and it keeps reacting. It's like coming off of something, and it's just breaking down in ways I never expected. So I'm in the just kind of the fight, keep going, keep pushing through, because I'm too young to not just keep going.
Hmm.
So sort of. Sort of.
You're, as we say, is you are only old when you think you're old.
Right.
I don't know.
And
Yeah,
I don't know if I always
Right
believe
now.
it. I don't know if I always believe it, because some days I feel really old. Like my body feels like it's really old.
Oh yeah, I think we all get that. Like I feel sometimes like
So
I'm 80 years old and I'm
But
not
you know
even
what?
50 yet.
I come in and I see you guys, I see your faces and the people in the chat, and
Oh yeah.
and really realize that this is important and this is necessary, and we just keep going and keep pushing and find ways to make people feel better. I just think it's really important for me to help in some way.
For me too. And I think the really amazing thing about how, Nick, you've put this together, and how at least my Substack has evolved and community has evolved, it has become much more focused on community as opposed to like putting out content.
Yes.
Right? It's like
Yes.
we're in the chat, we're connecting with you guys, we're connecting with each other. And I think that no matter how we feel physically, that is a positive thing for all of us, no matter what, because feeling like, right, it's hard to feel like you belong, especially if you don't go out very much, especially if you
Yes.
aren't in contact with a lot of people in real life. At least, having a contact daily or not daily. I see most of you daily
Yeah.
on some chat or another.
Yes.
I think it makes a big difference.
Yeah, I think I've put out less I haven't put out content because I'm watching lives. I'm involved in lives. But most importantly, I'm talking to people, and I just feel like, you realize how many people are suffering, and not that you want people to suffer along with you, because I don't. But knowing that people are having same or similar experience, and they're like, yeah, I need a hug too.
Oh yeah.
Just being there and saying, I see you, I hear you, I just think means the world.
Well, it does mean the world, both like individually, but one of the things that all of the experts on fascism say is the way you fight it is to have a close community, is to make connections with other people, is to bring joy into your life and bring other people that you can hug either virtually or physically. So it's, I think, both a personal uplift, a community uplift, and actually a societal uplift.
Yeah.
So
that's a perfect way to frame it, Stephanie. Yeah.
If I can point it out too, what I find amazing is, we tend to blame online social media for almost every problem in the world right now. But it's also a tool. Look at us. You are on the East Coast. You are on the West Coast. You're lost somewhere, Nick, down there.
I'm in the
And I'm
center.
up in Canada.
I'm
Look at
centralized.
us. We're I'm just teasing you, but we are, we're getting to be a more global community too. Right now, let's call it a North American community, but I'm just so intrigued to hear about what other people are, if we can unite right here on our own continent, and stop this insanity that's going out. I'm sure like people say to each other, like, sometimes just don't read the news today if you're not feeling good, because you don't want to, feel depressed and whatever. But I mean,
There's-
this is a
Mhm.
good side, I find, of the
There's
community
times
on
I just have
social
to
media.
walk out of the, chat, just leave the, watching a live and just going, oh, I can't see any more of this, at least
Yeah.
for an hour, walk away for a little bit, because it's all, gosh, I think it brings on stress and it brings on some flair. So it's like, okay, well, how can we make this positive? And this is one way. This is coming together and bringing community together, and keep spreading that. Keep, if somebody, when you're building community, if you see this live, forward it. Maybe there's somebody else that is having chronic illness or is struggling in some way, and they were like, okay, I need to be a part of that community and maybe get their answers. That's my hope, that it just spreads out and more people can be helped in some way, even if it's just to say, thank you for hearing me.
And
Sorry,
Yeah.
tangent.
no,
Good.
I'll butt in just for a second. That was really the hope of all of this, was mostly because I didn't want to be alone myself in talking about chronic illnesses, and I like writing poetry about them, and writing that wasn't enough or wasn't really helping all of the things that I wanted it to. It is helping, and you will still see me continue to put out poetry. I don't have the time right now to put out as much content as I want to there. But I'm working towards.
Be gentle.
Mhm.
Yeah, I'm working towards freeing up time in other places from the work side to be able to have time to also write poetry, so that I'm not the only one. I don't want to be a system of one. I want to be a system of many, where I can step back from, say, Banner and Backbone as being one of the sole main hosts. I'm on every show that's on Banner and Backbone. We're going to hopefully be starting some shows here soon that don't include me. And that means I can focus on the growth of mine, focus a little bit more on some of the stuff that I'm doing here, and then not worry as much, because I know that other people I'm working with and the friends that I built and the community that I'm growing here, or helping to be part of and grow, is because I'm not growing it myself. There's everyone here who keeps coming back each week. You're growing it. But like Beth said, and like we always ask at times, is like share, restack and share. Share with your friends, especially if you have someone who suffers from a chronic illness in their life too. I call us cousins in pain, because then we can all feel connected in a way with each other. So hopefully that sticks a little bit for some folks. Is welcome. If you're a cousin in pain, like, you're welcome here. And if you know someone who is, they're welcome here too.
And even if you only know someone and aren't suffering in the same way, you're welcome.
Yeah, everybody's welcome. Well, almost everybody. Nazis, you can stay out. I don't want to deal with you guys. Bots, Russian trolls, things like that. I don't want to deal with you.
If you're just a bad person, we really don't.
If you got better shit to do it elsewhere. We're here to talk about community building on disability issues, and I know one of our friends in the chat was talking about cuts to the insurance programs and Medicaid specifically and things like that. And I want to have more conversations in different shows like that while we're going. Just not today. I wanted to make sure it was known that we did see those comments and that we want to talk about them too, because I do talk about medical stuff a lot, and the health side, because it all impacts me and my family very, very directly. I'm just waiting for the day that they decide that they're going to cut VA disability benefits, and just be like, well, you're You don't deserve them anymore. It
Right.
was enough. We gave you enough. And
I
that's
feel
going to come. That's going to come if they keep the government shut down. Like that's not a future that is not going to happen. It will if they keep the government shut down.
And
yeah,
that's why we need
I
to keep building community. Sorry, Stephanie.
yes, you're
Yeah.
absolutely right. And one thing I wanted to say is like over time, I've talked a lot on Freedom Over Fascism about how do we connect, how do we talk about politics without talking about politics? And this is really one way, right?
Yeah.
Because whether we say it out loud, Nick, you could lose your VA benefits, I could lose Social Security and Medicare. Like it's all connected.
Mhm.
And community is the one thing that's going to help us all, no matter, you know, there's going to be a lot worse before there's better in this country. So like helping each other is the way to go. Nick, I kind of feel like if you're already in the system, it would take them more effort to kick you out.
Oh, it's going
Then-
to take them basically an act of Congress to kick folks like me out because you the disability status I have is basically irrevocable for the VA, and so good fucking luck trying. And I will fight tooth and nail to ensure that that doesn't happen. And I will sue the shit out of the government if they ever try to. Like, you want to see Banner and Backbone become a company that fuels lawsuits? Fucking take my benefits away.
We can do
Because
that too.
that literally feeds my family.
Right.
That's what ensures I have a house. Like the VA, Stephanie, you and I were having a slight back and forth on a note this morning about. I put out a note earlier today that was like one of the easiest ways to start fixing the social and economic gap inequalities in this country are a wealth cap and a wealth minimum. Oh no, it was something.
It was about healthcare.
And then I followed it up with it was something about healthcare. Whatever.
But I agree with you on the
Yes.
wealth situation too.
We were talking about. I was talking about healthcare and how we need to get over. Taxpayer funded healthcare would solve a lot of problems, and it would save Americans tens to hundreds of $1,000s a year. Most Americans. And here's how it would do it: a list of like 10 things you would stop, like 5 things you'd stop paying for right away. Which are your insurance premiums through your company, out-of-pocket costs for your doctor, out-of-pocket costs for prescriptions, out-of-pocket costs for ambulance rides, out-of-pocket costs for emergency visits, out-of-pocket costs for everything. And you could pay for it. And all you would need to do is just tax rich people. And that's the only way to get there. And we have 2 systems in this country that already work. One of which is the VA. No matter what the Republicans continue to try and do to dismantle and privatize the VA, it is still the framework for one of the most useful, socially funded medical systems in the country. It is the leading provider of research in this country and training for young providers.
Everyone has to do a rotation. All the doctors in their training have to do rotations at the VA.
Yeah, and they have specialized care at the VA that you don't get anywhere else. Burn pit care and investigations for toxic chemicals and the links to cancers. I had a friend go from healthy to dead in 6 months.
Oh God.
So, and the VA is the only reason we know like what type of cancer and how that cancer got caused, and why the rest of us got access to the PACT Act, because that type of cancer was spreading and they needed to understand it better. And federal funding, that's our taxpayer dollars at work. I want everyone to have access to that. I get unlimited mental health care visits a year, unlimited, through the VA. Nobody else gets that. Why?
Well, I mean, I pay so I'm on Medicare. I pay premiums, and I pay premiums for a a backup, but pretty much I get everything else like that I need. Like, because the backup insurance pays the things that the Medicare won't, and it's much more a month, although not nearly as much as what people are going to have to paying like now. But we have models. It's not like it's rocket science. We have 4 different freaking healthcare systems in this country. It's ridiculous.
We could just look at Canada.
That's
Theirs
insane.
works.
It is
Theirs
insane.
works. Like, we could just model ours after every other developed world country that does it too. Like, that would be the simple solution.
I will just say one thing.
Yeah, go ahead. Go ahead.
Sorry, I mean to cut you off. I don't mean to cut you off, but I will, because people say our healthcare system, okay, it's not perfect, but it is working, even though people are, I find that people here, especially in Quebec, they don't look at what's going on elsewhere because they always like complaining all the time. But I mean, look at my mom. I mean, she had a 4 bypass surgery. What did it cost? Because we just had to pay for the parking, because we had to go to the hospital and da-da-da-da-da. But I mean, where else? I mean, I'm saying well else. There are countries like us, even in Spain, healthcare is
almost
universal healthcare is so important. But I'm worried. Because right now in Quebec, we have more and more people that are getting influenced by the private sector, and our current government has opened the door to it. So they're opening private medical clinics, and that I will never agree with. I mean, I even have access, like, say, through my spouse's, to a private service, and I don't use it because for me, I won't encourage it. I don't think it's the right way to go. But I mean, people, I can understand. They're like, well, if I pay $300 and I get to see the doctor right away, then I'll do it. But then, we're not fixing the problem. We're just opening the door. I mean, this is my personal opinion, but I mean, all the provinces in Canada will tell you we have like issues with the way things are organized for sure. But still, at the basis, people are like, free healthcare and just, general global healthcare. It's so important. If you take care of your people, then they're going to be able to function in your society, and then they'll be more productive, which is what you want, right? Well, anyways, I'm sorry. I'm going
to lose my insurance. It's going to double. I'm one of where my insurance is going to double, and we're not going to be able to do it. So,
how do we call ourselves the richest fucking country in the world?
I don't know how we're
because there are 4 people that have all the money.
Yeah.
It's not true. 4, seriously.
Yeah.
Between Bezos, Zuckerberg, Musk, and Ellison, that's where all the money is.
Yeah. So here's an idea: is we tax rich people. Here's an even simpler idea: is we tax everybody over $100 million in income, personal income, and then we set a separate corporate profit amount based on the number of employees you have, and actually is a percentage yield off the number of employees. It's like, we could really easily do this. If I'm coming up with these ideas, that means an economist has come up with this idea somewhere and been like, nah, this is too easy to implement. Let's do the more fucking complicated way.
Let's make you pay to give us your taxes when we already have all the freaking information.
Yeah.
Like TurboTax and whatever other tax companies and H&R Block who pay to ensure that we have a complex tax system so that they get money. They're the health insurance companies of the tax system. Like, that's what we should be treating them as. They're leeches on our society. The easiest way to pay for taxpayer-funded healthcare, and I'm going to continue to call it taxpayer-funded and not free, because it's not fucking free. It is taxpayer-funded universal health coverage. We just need to tax a 99% effective tax rate on anything for individuals over $100 million. And that's just an arbitrary fucking number. I'm just arbitrarily saying, hey, rich people, you can keep up to 100 million of your dollars, but everything after that, reportable income of any sort, guess what? It goes back into the system, and it pays for universal basic income. It pays for universal healthcare services and other things like that, where instead of pushing people down and making us sicker and worse, and then increasing the burden on the healthcare system, which then makes it more expensive because less people are paying into it, and then you have to pay more into it yourself to be funding all the people who are now no longer insured and are still using the system. It's almost like it's a catch-22. The less people who are there paying for it, the more you have to pay.
Right. And the more all of us have to pay, because how many people are going to go to the emergency room because they don't have any other kind of healthcare,
Mhm.
and
Yeah.
then that raises the cost.
We
of
just have to
everything for
tax like
everybody.
4 people. 4 fucking
Ooh,
people.
yes,
We can send a
Who-
cute little
who-
card, hi.
Yeah, like we could give you even if you want, we'll give you a golden man card that just says, "I'm the man. I donated all my money
Yeah.
over $100 million. My
You know,
penis is bigger than yours. It's
Bill-
made out of metal."
Was
Like,
it
Right.
Billie
here you
Eilish
go.
that called on millionaires? Billie Eilish this weekend called out billionaires to just start. Didn't
give
you
it
see
all
that?
away.
I hope
Yeah.
she did.
Yeah.
She does a
Bill
lot.
Gates
She does that a
decided,
lot.
like, gives it. My husband's wrapping up a project with the Gates Foundation. He and Melinda, who are no longer together, give away so much
Mhm.
money because
Mhm.
they know you don't need billions of dollars to, like,
You don't.
nobody needs. You can't spend it.
That's why I
Like-
never rail on Taylor Swift, because she gives away millions and millions and
Yes.
millions and millions of dollars.
Mhm.
And yes, she is a capitalist. Yes, she makes a whole bunch of money. She also just bought the rights back to her own artwork
That's
and
good.
had to and was forced to spend $500 million to do it,
Right.
which means some capitalist asshole forced her to buy her own work back. That wasn't her doing.
No,
That was
took
somebody
it in the
else
first place.
who took it and said, "No, you have to buy it back from me. Here's how little or here's how much I'm gonna make you pay to do it." And you know what? She went and fucking did it.
Mhm.
Right.
But she also
Not-
pays her people really, 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 really well, and gives bonuses and is super kind and friendly and gives back in a lot of ways.
Hmm.
And she's not as greedy.
Yeah.
As she hasn't been corrupted by the money.
More of that.
I just
So-
read that she gave enough money in every place that she toured
Mhm.
to food banks to
Hmm.
fund them for a year in every city she played.
See, these people should be celebrated, and I mean, I find that they earn. I mean, and most of the time, they're humble. They're not gonna. I'm sure she did it, just to like call out on others, do the same, because they
don't
don't
think
want to get they're not gonna go after like the glory of saying, oh, I did that. They're humble in that way. I mean,
Mhm.
and how many of these people, I'm saying these people, like the people that we don't necessarily know about, also use their money to take care of their family. I mean, I don't know there. I was just,
Mhm.
I was listening. I don't know, you like him or not, but I was listening to a podcast with Anthony Scaramucci and Katie Kay there, called The Rest is Politics. And I find he's really funny. I mean, you may like him or not, but at one point he was talking about how, I'm sure he takes care of his mom, some cousins, I mean, the guy's a billionaire and, he's not, yeah, so maybe it's not the perfect example, but I know, like, we're talking about taking care of each other. It's not just about, taking care when they're ill. It's also sometimes giving back, because it's not everybody who will either have the luck, will have the brains, or will have the physical capacity, or all at once.
So maybe wrapping this into part of our show discussion as we reach the top of the hour is part of this too is maybe at a certain point, and say certain mental illnesses that some people suffer from, there need to be regulations in place that force them to recontribute their wealth back into society. Otherwise, they're too narcissistic or too self-aggrandizing on a capitalistic side to do it themselves. Because Elon Musk will never do it just because he gets like a little bit of praise or anything like that. He would demand everything. He'd demand, like, people like that, especially men like that who are billionaires, tend to demand everything
Mhm.
without ever remembering that there's something underneath that they need to do. Like respect is earned and leadership is earned, and taking care of others is a great way to use your wealth and your influence to actually create a legacy that doesn't suck.
Yeah.
Like I want the least I could do leaving this world is leave a legacy that doesn't suck.
Mhm.
And the best I can do is leave one that's really good. So I'd at least rather try to leave one that's good than one that doesn't suck.
Thank you for that
Absolutely.
deep insight. Love it.
All
Yeah.
I'm here
right,
for
there
you.
we go. Let's
There
see.
we go.
I
Getting
can't
some
get it to
parts.
damn work. Oh,
There you go. It's about the bottom of the heart. I think it's about the shape of the bottom. I don't know.
there we go.
There you
There we
go.
go. Okay.
I'm not on my Mac.
I'm gonna do our amazing switch because I also want to show off the cool new design that Stephanie has been putting together for me, or threw together this for me this morning.
Look at
And
you
I want to
guys.
get
I'm
y'all's
scared to get out of
feedback.
bed.
It's not putting it
Um,
together for you, Nick. It's putting it together for all of us.
For all of us. You're right. That's
Forever.
true. For all of us. For everyone in the audience too. This is for you guys. Stephanie made a really amazing piece of artwork here for us. Put it together for us all, and I want to show it off, get everyone's feedback, and if we like it or if we love it, we're gonna keep using it, and it's gonna be fun because I like it a lot. So
I'm glad you do.
this is the new reimagined Sick of This Shit Publications logo for today. This is an amazing start to our day with Stephanie and I collaborating back and forth to figure it out. And she made a really cool design. I'm really enjoying it. Plus, we have our new chronic illness in practice in the bottom, whole new background. So all that great stuff. But I'm going to hand it over to all my friends here. Starting with, we're going to go Stephanie, then Sosa, then Beth to close it out. And then I'll hop back on here at the very end to close out and say goodbye to everyone. So thanks, Stephanie, for the new design for Sick of This Shit Publications, as well as join me. We've got a 50% off sale for November to start the month off. To help continue to grow the paid publication side and build out the actual publication and long-term support for it. So thank you everyone so far who's free and paid subs. I appreciate everybody. And don't forget, support the show by sharing, liking, and forwarding those emails. And then next, we're going to move on to, like I said, my friend Stephanie.
So I probably should put the actual logo. So I have the.
Oh yeah,
Freedom
send me
Over-
that, and I'll put up a logo for you.
My Freedom Over Fascism logo.
Yeah, if you
Or-
want,
yeah, yeah.
if you want me to for that, I can definitely do that.
Yeah. Okay. That's probably better than my face. Yes, that sounded really horrible. But anyway.
You were telling me to be nice to myself, Stephanie.
I meant that people would see the brand of the show and not just me. Okay. Now, I do Freedom Over Fascism. I have started doing 2 times a week live on Tuesday and Wednesdays at 1 Eastern. I'm here with Nick on Mondays and the Anti-Fascist Book Club on Fridays. And I talk to as many people as I can to think about where we are as a country, how do we get better, and then think about really radically creative ideas when we rebuild this country, as we will be able to at some point. So freedomoverfascism.us. Come see what I podcasts, and I write stuff too, which I did this weekend because when it comes out, it just like bleh, comes out in writing. That was very nice, I know.
Nothing wrong with a little word vomit for the morning. She also has an incredible couple sets of recent interviews that I highly suggest everyone watch. Is the Marlon Weems interview and the Dean Blundell interview. Those are two of her
Very good.
most recent, and they are incredible. So listen for the audio only ones if you want, and or watch the video ones. They're both great. I would highly
You
suggest.
can also read the transcript if you don't like either of the others. So, and also my conversation with the Contraband Wagon, Will Fullwood.
Oh, Will Fullwood, yeah.
yeah,
Walter Ryan knows Will Fullwood.
Yeah,
pretty
so
well.
he interviewed me for his anti-racism work. So there's that
That's
out
awesome.
there too.
That's amazing. I'll have to watch that interview.
It's sadly close to 2 hours, but you don't have to watch the whole thing.
Speed and a quarter, speed and a half.
There you go.
I've got time. All right, so my friend.
Oh, okay. Well, okay. What am I supposed to say?
Who am I? What is this? Where are we? What are we doing?
Yeah, what am I doing? Okay. So I'm So. I live in Quebec. I'm so glad to be on Substack. I am actually still figuring out what I want to do with my Substack. I am right now, and always will be more interested into people, nature, connections. I think that's about it. I started doing lives back in May. And I would like to give a shout out to my really good friend, Kat, who is maybe not in the chat today, but she did a wonderful live yesterday with Courtney, who's in Canada. And I will put on her link in the chat because I do also go with her sometimes on Thursday evenings with our therapist, Dr. Litton, and we do discuss psychology because if you don't know me, I have a master's in psychology, but I just don't practice anymore because I'm interested in other stuff. So yeah, I'm focusing on wondering what I'm going to do with all this, but I know that right now I'm, as you can see in my picture, I am hoping to put on more nature pictures because I also do photography as a hobby. But I would say most likely hanging out with you guys is my first priority right now because you guys are great. And I do feel like we matter, our voices matter. And all of us together are stronger than one little individual at one place, separated and apart. So let's go, guys. Let's fight fascism. There you go.
Oh,
And before I get too distracted on other things, let me switch over. Beth, my friend.
hi, I'm Beth Cruz. I write about trauma. You can find me on Substack. I am here every Monday with this beautiful group of people and all of you, and really finding that beyond becoming a chronic illness warrior, I'm, here fighting for our country. So glad to be here.
Glad you're with us.
Glad to be here.
Oh, Stephanie got it this time.
She did. Thank you.
Thank you,
Appreciate
Beth.
everyone.
Thank you, So. Thank you, Stephanie. Thank you, everyone
there
in
we
the
go.
chat.
Oh, I was like, what are we doing?
Nice. I think there's a way to make it rain, but I'm not quite sure.
Yeah, I don't know how to do that either.
I don't know how
I need to interject. Okay. Please, people, shout out to Nick because Nick has been putting this
Yes.
awesome network and he's still working. And I'm sure, he's already doing great things, but I know he's going places. So
Yes.
Thanks, Sasa.
Yes.
Thank you guys.
I agree.
Thank you. And thank
I really
each one of
appreciate you guys being a part of it and joining me in this, especially. It's been a lot of fun getting to know the three of you over the past couple of weeks and doing this. So thank you. And thank you, everyone in the chat. I appreciate all the support and all the love. Come join Shane Urick and me here at the top of the hour at 1 p.m. Eastern time for another episode of Palin Talk on Banner and Backbone. And then come join us next week on Monday at 11 a.m. Eastern time, as always, for another chronic illness in practice. as the four of us come back together, and we'll figure out a new topic for next week and where we go. And thank you everyone for the love and support. We will see you all soon. And as always, let's stop being sick of this shit and let's start doing this shit. Have a great one, y'all.